a young boy is rushed to the emergency department of a hospital, where his family reports that after ingesting peanuts, he began experiencing an allergic reaction. Doctors diagnose him with anaphylaxis. But what is anaphylaxis? And more importantly, what is happening to his immune system when this reaction occurs? A basic understanding of the immune system is required to figure out what's really going on.
Your immune system is made up of many different cells, and one of the most important cells are plasma B cells. These cells release antibodies that are designed to target foreign substances and pathogens. The antibodies bind to these substances, and other immune cells called phagocytes, such as macrophages and dendritic cells, will recognize these bound antibodies. Once bound, these phagocytes release chemicals called cytokines to warn an army of immune cells to arrive at the site of infection and fight the pathogen, either by secreting antimicrobial substances or swallowing it. But in an allergic reaction, like the one seen in the young boy, mast cells recognize and bind to the antibody label and use the antibodies on their surface to bind the specific antigen that corresponds to the peanut fragments in the blood. Once this binding occurs, the mast cell warns other immune cells by rupturing and releasing inflammatory mediators, such as cytokines to signal other cells and antimicrobial toxins to kill other cells. Histamine and heparin in particular act to dilate the blood vessels, making the blood leaky and allowing for an army of immune cells to arrive at the site of infection. These responses are collectively known as anaphylaxis. Ana from the Greek word ana meaning thoroughly and phylaxis meaning protection. The body's thorough protection mechanism.
Anaphylaxis is a rapid onset, life-threatening allergic reaction that is related to a spectrum of symptoms. It can be caused by foods, medications, and environmental factors. Signs and symptoms of anaphylaxis include nausea, trouble breathing, swelling of the lips, eyelids, and even your tongue. Depending on the type, amount of allergen, as well as the way in which an individual's immune system responds to the allergen, signs and symptoms may vary, but there are a variety of treatments that can be used to help.
The use of antihistamines is an alternative solution that can help relieve some of the symptoms of an allergic reaction, such as hives or pink eye. EpiPens are used to treat anaphylactic shock with the injection of a hormone called epinephrine. Epinephrine will act on the adrenal glands to increase the rate and force of the heartbeat.
It is still unknown why some people like the young boy have this abnormal reaction to certain substances in the environment, or why certain substances are more likely to cause allergies than others. But if you are experiencing anaphylaxis and keep an EpiPen on you, you can buy yourself some time until you make it to the emergency room.